Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today, I'm super pumped to talk about a topic really haven't dived into much ever on the show before, which is peptide therapy, peptides in the use, how women can use them for autoimmune disease, to hormone balance, and really just everything in between. We're going to understand what are peptides, if you've never heard of what peptides are, as well as just understanding a little bit more about just kind of how they can be effective for helping you regenerate your health. And I've got Dr. Amber in the house, and Dr. Amber is a licensed naturopathic doctor at Metro MD Institute of Regenerative Medicine in Los Angeles, California. And she's trained in regenerative medicine, detoxification protocols, hormone testing, bioidentical hormone therapy, anti-aging protocols, peptide therapy, and IV nutrient therapy. So many modalities to help back your own health. And Dr. Amber, just super pumped that you came on the show. If you could just briefly introduce us to who you are and really what got you doing the work you're doing in the world.
Absolutely. Yeah. So thank you for the intro and thank you for having me. It's fun to be here. So essentially my journey started when I was pre-med, going into what I thought would be MD school, and really, was really passionate about nutrition and women's health, and struggled with health issues like eczema and, some definite immune dysregulation as a kid. Didn't really know what was going on at that point in time. Didn't know what to do about it. Grew up on a standard American diet and sought out a lot of information as I got into high school and college about nutrition, about sauna and detox and some of the fundamental pillars, botanical medicine, all of these herbs, things that we can use from the earth that really can change and support our physiology. And so I was pre-med, going to go the MD route, job shadowed a couple practitioners, and really just kind of witnessed the system that was set up. And, I hesitated at that point in time. It was really disorienting for me because, the doctors that I had worked with during that period of time, they had big hearts. They were incredible individuals, but they were stuck in this kind of system of medicine, these 15-minute appointments where they had to be in and out with patients. And, we'd have somebody come in on 6 medications and walk out of the room on a 7th. And it was just a really brief visit. I felt like I didn't have time to do the work that I really wanted to do with patients. And so I rethought my plan and, switched to my major for a quarter. And it was just like, I don't know if I want to do this. And then found out about naturopathic medicine, which rerouted the course of my life and really became passionate about it. Got accepted, went to 4 years of medical school, did a clinical year in San Diego. And then, really post-graduation, got super passionate about women's health because I saw how many women, whether it be going through menopause, postpartum, trying to conceive, women who are now bearing this load of being a mom, the working life, or just even the pressures that young 20 and 30-year-old women have, and the cortisol dysregulation and how that impacts their thyroid and their sex hormones. And I really got passionate about supporting those women. And I saw such a need there. And then learned about peptide therapy, which is this novel therapy that's really complementary to hormone health. So I love what I do. I get to support women. And I guess the big why behind it is that I believe that when women are supported better, that they can show up to be their highest self in their relationships, in their business, for themselves. They have better energy, cognitive focus, and, using natural medicine to do that versus what women are constantly told that they need to be on birth control, they need to be on medications. There's another way. So I love being able to offer that and to work with so many women. that
Yeah,
way.
no, I love that. And I love, yeah, I mean, it's a huge pool us women because we have, I think they say
Yeah.
women have, I mean, definitely just more imbalances in general. I think greatly related to our hormones being more delicate or just more sensitive to changes. But what I would love to know
Yeah.
from your perspective, why you think that is, that women tend to have more maybe like chronic disease statistically, from like an autoimmune perspective to like, again, a hormone perspective.
Yes, it's a great question. So, we have this thymus gland that's really produces what we call thymus peptides. And so this is kind of bridging into the peptide conversation and how it relates to women's health. Uh, so up until about the age of 30, our thymus gland is, pretty functional. It's producing a lot of those thymus peptides. Thymosin alpha and thymosin beta are the two main ones, but there's multiple. There's more than that. And so what happens is that the thymus gland involutes, and we know this. I studied this in medical school by the age of 30. And so when it involutes, it becomes less effective at making some of those peptides, those signaling molecules for the body, for the immune system. And so that's one of the reasons why we might see an increase in autoimmunity after the age of 30 for a lot of women. And it can happen for men too. So really it's looking at why is there so much immune dysregulation. There's multiple factors. That's just one of them. We can look at cortisol, chronic periods of stress where women are constantly secreting cortisol, kind of that fight or flight state. And over time, we know what that does to the neurotransmitters. We know what that does. Elevated cortisol is linked to later on depression because of how it can impact neurochemistry and brain chemistry. And then, we know all the effects of cortisol and how it regulates blood sugar and metabolism and so many immune effects. So that's also a huge factor too. What's the impact of a woman going through, a professional program like law school or med school and being exposed to that level of chronic stress for a long period of time, pressure, sleepiness, which further compounds cortisol dysregulation. And then what does that do to her immune system over time? And why is that leading to autoimmunity? So much of it is looking at the hormones, cortisol being, I think, the ball that gets everything rolling for a lot of women in terms of dysfunction and immune dysregulation.
Yeah, it being such a tipping point in so many directions, be it
Yes,
immune health or hormone health. Well, you kind of
absolutely.
mentioned peptides in our body. I mean, give us a broad layman's definition of what a peptide is, and school level,
Yes.
yes.
Yes, I would imagine that most women, when they hear the word peptide, they think about the collagen peptides that they take, in their smoothie, or maybe the peptides that are in their high-end skincare product. And those are peptides. It's a similar idea, but a slightly different format. So essentially, what is a peptide? It's a signaling molecule. So every cell in our body works through like docking stations. So we have these receptor sites, and peptides essentially can, cause a signal at the receptor site and change something that's happening inside the cell. And that's really powerful if we know how to do that, and we know what, we've had enough research where we understand, if we signal the cell to promote this, we can support a pathway or prevent degeneration of a tissue or an organ. So, for example, we know the pathway for hair loss. We know the pathway for the degradation of stem cells in the hair follicle. So we can give a peptide. One of the ones that I use for men a lot, and we use for women too, is called PTD-DBM. It's just a chemical name for a peptide that we know that will signal those hair follicles to keep producing. Right. So we can use certain peptides to signal the body in positive ways. One of them being in autoimmune conditions. So there's a peptide called thymosin alpha that, and this is an injectable form. So there's all different forms. There's capsules, there's injectables, there's topicals. There's, many different ways to signal the body. But really we're helping the body to do better at what it already knows how to do. And that's where it differs from a pharmaceutical drug. There's no suppression involved. There's no, our body makes these peptides already. What happens is that they're just in decreased amounts due to environmental exposure, hormone dysregulation, all sorts of things that our modern day has caused for us. So we can increase those thymus peptides, thymosin alpha, thymosin beta, and essentially the way that I describe it is that we can kind of reset the immune system. So we can reset those immune cells so that they have self-tolerance, so that they're not attacking self. They're not attacking the thyroid in autoimmune thyroiditis. They're not attacking, the gut in Crohn's disease or the spine in ankylosing spondylitis. We can really help retrain the immune system with those peptides signaling, which is profound.
So is it kind of like digestive enzymes, for example? We make them on our own, but a lot of times people are suppressed in them. So we take them and then you take them for a while and eventually you build up your digestive superpowers to not need to take them as often, or to just take them if you're exposed to gluten or something like that. How does peptides work, and are they prescription? Are they supplemental?
Yeah. So there are certain peptides that we found that you take them for a period of time, anywhere from 2 to 3 months. I'm thinking about a specific peptide we've done research on. We found that your baseline levels of growth hormone, even after you quit taking it, rise, and it's working through your body's own production. It's not working through a synthetic form. And so we know that, it can actually impact the baseline level, even when you're done taking it, which is pretty profound. Mm-hmm. But they are a prescription product. So yes and no. Currently the FDA had changed some regulations in March of 2020 about peptides, so that there were some of them that went off the market and became what we call a biologic drug, or the FDA saw the need to regulate them and turn them into a pharmaceutical medication, because right now the world of peptides is exploding. Doctors are learning about it, patients, there's more information on the internet. That I don't think there's a lot of comprehensive information. So the FDA saw the need to step in and say, hey, we need to regulate this. This is, really growing. And people are using it. And then you can buy peptides online, but where they're coming from is China. Generally, they're not tested. They're injectable, a lot of them. And they say for veterinary or research purposes only. And I would never trust injecting something like that into my body, nor would I ever recommend that to a patient. So the ones that I use in my practice are through a compounding pharmacy. They're tested. They have a $500,000 machine to test them. So you can't mess around with that. Yeah. And there's dosing protocols. So I'm trained by the Academy of Anti-Aging Medicine, A4M, and we learn very in depth, who is this indicated for? What does it help with? What are all of the pathways and the mechanisms of action of the peptide, contraindications? What's the dosing protocols that we use? So it is really something that you need to work with a practitioner for. It's, you could think about it as a prescription medication, but it's not through big pharma. It's working on your signaling pathways. It's more between the level of nutraceuticals and pharmaceuticals. I'd say it's kind of in the middle there.
Okay. Gotcha. And how would one even know where to start? Since a lot of practitioners probably aren't as schooled on this, or you said, it's evolving. Even they wanted to explore it with their general practitioner, is that something that they really need to go see a specialist for?
Yes. And that's where, there's very few practitioners who are first A, trained in peptides, and B, trained in women's health and hormones, because there is a beautiful blend. And so that's where I'm seeing a lot of my clients too, is that people are reaching out to me and so they've been learning about peptides. They listened to Ben Greenfield or, read something about it and got really curious. And historically, peptides have been used in the bodybuilding world. So it's been kind of a male dominant thing, and women were never really curious nor interested nor saw as much value in it. And the peptides that I use are and not the same peptides that were being used for bodybuilding and putting on mass, like MK677. That's, one that helps you to build mass. And some of those have massive side effects, but they were using them in the bodybuilding world. And, for the most part, the peptides that we use now have a very low side effect profile because they're like an enzyme. We're helping the body to do better what it already knows how to do. And so, but now there's been this shift where women are seeing the value and seeing changes and impacts, especially in autoimmunity, especially in sleep issues. My goodness, I have so many women who have trouble sleeping at night, and there's a few specific peptides, one called delta sleep inducing peptides. So it gives you those deep delta waves that helps regulate hormones. Mm-hmm. And then the thymosin alpha peptide is amazing for re-regulating the immune system, helping to produce the proper amount of those immune peptides. And then there's another one called CJC ipamorelin. It's a combo. It's 2 peptides in 1 vial. And that one, I've seen women report better energy, deeper sleep, body fat composition goals. It helps your body increase its own production of growth hormone. And so it's that repair and regeneration that we get at night when we're sleeping. And it just kind of boosts that and enhances that nighttime repair, which is phenomenal and can really make a difference for women. So yeah, there's kind of a resurgence of using it for women's health. And I love that I get to be a part of that and kind of bring it to light for women and take it out of this kind of the past bodybuilding world.
Yeah. I mean, it sounds like a panacea when you talk about it a little bit. And does it negate the use of like needing things like adaptogens, for example, for a woman's like cortisol balance or like immune, natural antihistamines, like just kind of some of the more like holistic drag and drop approaches that we'll take in a functional medicine practice even?
Yeah. So not necessarily. What I have seen is that when I think about peptides, I think they work on quite a deep regulation level in terms of what's happening in the body. So I've put women on, for example, CJC ipamorelin. It binds the pituitary. I've had women who have to decrease or completely go off of their bioidentical testosterone because their body's own synthesis becomes efficient. So, yeah, but it doesn't take away. I'm still running hormone panels on my patients, and I'm still giving them adaptogens, and I'm still giving them formulas to help with that. But sometimes, the reason that they're not waking refreshed is they're not getting into those deep delta waves. And so if you do get them that really deep restful sleep, and sometimes I'm not promoting like 10 hours of sleep, but more efficient sleep, not more, but efficiency. And so that's what some of the peptides are really phenomenal. And I know that Ben Greenfield and founder of Bulletproof, Dave Asprey, they talk about some of the benefits of how they can sleep 6 hours a night or 7 hours a night. And these peptides will get you this deep, extremely restorative sleep so that you don't necessarily need more sleep. You can actually sleep less, but you're in this really deep delta wave sleep, getting a ton of REM, a ton of deep sleep. And so that's what's possible with peptides. If women are getting that, their hormones naturally regulate better.
Yeah.
Right. You get that restorative sleep.
Right.
So, but yeah, it's not an end all be all where that's the only thing. I use it in conjunction with other modalities. So botanical medicine and looking at cortisol levels, adaptogens for sure. So it's not just that, but sometimes that makes such a big difference that, if the sleep is deeper, they wake up feeling refreshed, the cortisol kind of regulates itself in some regard.
Mm-hmm. And then would it be like the game plan is kind of just like there's not really an end to taking them? And then what is typical like cost run for a patient?
Yeah, good question. So there's different periods in which I have people take them. So usually I have them cycle on and off. with, in particular, the CJC ipamorelin. And that's just to keep the receptors wide awake so that they respond. But there's other peptides that you could take every day, like one called melanotan, and that one has some positive immune benefits. It does promote tanning of the skin. It acts on the melanocortin receptors, and there's a lot of research about the melanocortin system and how it can impact immunity in a positive way. It can have protective effects, and so that peptide doesn't necessarily ever. You could keep taking it. The threshold is to how dark your skin gets. But I've used that in women who have mold exposure, mycotoxin exposure, because they have really low MSH or melanocyte stimulating hormone. We give them that peptide. Their energy improves, their immunity improves, their sense of well-being, their brain function, their cognitive capacity, all of that. That we see their MSH levels rise on labs. Pretty profound. So that's one of the ones. There's a couple of them that I use in like Lyme, mold, some of those chronic infections. Thymosin alpha-1 is an amazing one for Lyme and mold, mycotoxin exposure as well. So it depends on the peptide. Sometimes it's like thymosin alpha. If a woman has an autoimmune condition, we're going to have her on that for at least 3 months and then kind of see how she's doing at that point in time. But a general cost point is generally about $300 to $600 for a 5 ml vial. And that could last anywhere from 1 to 3 months. It just depends on the dosing protocol. Sometimes we dose higher. Sometimes it's a really tiny dose twice a week, so.
And do you ever see negative side effects? Or is it pretty...
So if you look at the have like an informed consent for a lot of the peptides, and the side effect profile for most of them is redness at the injection site, potential burning, or a little bit of a sting from injection, which is what you get from a B vitamin or any sort of IM injection anyway. It's possible that people can build antibodies to peptides. And so that might be where they notice, if their body has a really dysregulated immune system or very reactive, they may build antibodies. I've seen that once in one individual where they built antibodies to CJC ipamorelin. So it's possible, but it's extremely rare. Mm-hmm. So the only other potential side effects is sometimes some flushing. So with the melanotan, you might feel like a little warm feeling, but it's normal. It's completely normal. It's expected to happen. Some of them, we have a peptide that's now being used for women's health. It's called PT141. It's phenomenal. It's like the woman's version of Viagra, and it acts on the central nervous system. Are you familiar with that one at all? PT141?
Yeah.
Okay. Yeah.
Definitely.
So that one's being used more frequently, specifically for women as well. So, and it does work. You can take like a sublingual. I recommend using the injection, but it does have some of those melanocortin, binds to that melanocortin system in the brain, and it just works on the central nervous system. Essentially makes you feel aroused before sex for women who have low sexual desire, and it can, change somebody's life relationship using something like that. So, yeah, it depends on the peptide. It depends on how long or what the dosing protocol is. But usually it's a 1 to 3 months, protocol, and then, reassess at that point. And some peptides you could stay on indefinitely, but most of the time we cycle them off, and they get dramatic results from that, short period of time.
Very cool.
Yeah.
And so your recommendation for people partnering with the practitioner, like where would they find a practitioner that is best suited to help them?
Yeah. So the International Peptide Society, the IPS, it's a membership for doctors only. And that's where a lot of information, there's monographs on all the peptides. There's information on side effects and informed consent and everything that, you need to know as a practitioner. So you can reach out to them, and you can find, historically, they haven't been super responsive, because I actually sent in a request to see if I could find a doctor, and I didn't hear back for quite a while. And I think it's just because they're short staffed, especially during COVID. But yeah, the only other way to go about finding a practitioner, sometimes through A4M, you can locate practitioners who are trained in peptides. A lot of people find me online. They're just searching for practitioners who are trained in peptides and can prescribe them. And they've researched, either they have mycotoxin exposure, or they have an autoimmune condition, or they have, some severe hormone imbalance or body composition goals, or very specific things. And they know that this peptide can help because they've researched it a lot. And then they adamantly look out for a practitioner who can, connect them with that. So yeah.
And do you work with folks like outside of California?
So I have, on a pretty limited basis. Most of my patients are in California. So I have a practice in Redondo Beach, and I have a practice in Studio City, so the south side of LA and the north side of LA. But I have worked with some patients outside of the state, yes.
Okay, cool.
Yeah.
I know I definitely will be posting all your links in the show notes. And you do have a really awesome, was it a book, right? A peptide playbook?
Yeah. So the peptide playbook, which just talks about using peptides, not needing a prescription from a practitioner, but how they can really support regeneration, repair, collagen synthesis, healthy skin through diet, through lifestyle. What are some of the practices that you can do at home for that, aside from meeting with a practitioner and, using the injectable form of some of the peptides?
Yeah, no, I'm super pumped for that. Thank you for that gift for the listeners. And thanks so much. I guess your website is what?
Yeah. So where they can find me is drambernd.com. And then they can also find me on Instagram, Twitter, Facebook at Dr. spelled out DOCTOR, Amber, ND. And then also on YouTube, I have some videos about peptides. There's a really great video on BPC 157, which is that gut peptide. And a ton of people shared their story on it, which I didn't expect to happen, about how it changes their gut health or their condition. And so that's a cool find too, if you're looking for more about peptides.
Very cool. And that's Dr. Amber, ND, N as in Nancy, D as in doctor.
That's right.
Okay. Thanks so much, Dr. Amber, for coming on and schooling us in peptides.
Absolutely. Thanks for having me. It was a pleasure.